Good afternoon, everyone. We will be getting started in just a few moments. Just giving it a few more minutes for folks to join in. All right, it looks like we are pretty much all here, so I'm going to go ahead and get us started. I just want to start out by welcoming everyone to NCSL's COVID-19 and Child Welfare Series on virtual meetings. Today's program is the final session in a 5-part series of interactive virtual meetings that began in June. Time has really flown by, but we launched this series back on June 10th, and since then, we have provided a national perspective of child welfare and how COVID-19 has impacted the workforce, fostering kinship parents, as well as congregate care. The previous presentations are all available on NCSL's website. And for those of you that are new today, my name is Donna Wilson. I'm a program director in NCSL's Children and Family Programs, and I will be your host for today. We're also joined by my colleague, Nina Williams-Mbang, who is a senior fellow in the NCSL's Children and Families program. So as I mentioned throughout this series, children and families of color have received desperate outcomes when navigating through the child welfare system and the pandemic, and also the subsequent economic downturn, as well as the national race relations crisis, which is all just really further shed light on these disparities. And so we just ask that as you listen to our panelists today, that you keep these families in mind throughout our discussion. I also want to once again highlight the 60 statements from legislators addressing issues of racism, as they've offered guidance and insight into what legislative leaders are thinking and how they are reflecting on issues that many policymakers feel need to be addressed during this time. This will also be included in our resources that we'll share with you all at the end of this session. For starters, we'd like to thank both Casey Family Programs and the Annie E. Casey Foundation for their support to this project. And I want to just start out today letting you know a little bit about our agenda. We're going to have an audience poll. I'm going to do a brief introduction of our speakers and let you know what agencies they represent. And then we're going to have something a little different. We're going to have a talk show format panel discussion, which my colleague Nina Williams-Mbang will host. And then we're going to wrap up our session and share some great resources with you all and conclude with a 2-minute online evaluation. So today we are hoping that you will learn about the impacts of COVID-19 and the impact that it's had on older youth in foster care or young adults who are transitioning from foster care. And this is going to include challenges related to housing, school closures, limited court capacity, and childcare needs. We're also going to hear ideas on what support could look like from our panelists, including challenges related to them aging out of the system during this pandemic. So just a bit of housekeeping. If for any reason you need help during this call, just refer back to that Zoom cheat sheet for tips. If you have problems or if you inadvertently get dropped out, just simply reuse the link that you used to originally join the meeting. And then I just also want to remind you all, just please put any questions that you may have as you're listening to our panelists into the chat box. So today I want to tell you who we are joined by, and I hope he's had a chance to make it on. I'm going to holler out his name just in case. We are joined with So Cancel, who is the founder and chief executive officer of Think of Us. We also have Amanda Metiver, who is the co-founder, director, board member of Facing Foster Care in Alaska. And lastly, we will hear from Galilea Caruso, who is a member of Think of Us. So before we get started, I just want to provide you with a really high-level overview about youth, older youth in care. And so according to last year's federal data, there were nearly 18,000 foster youth who aged from the system in 2018. Youth formerly in care who age out fare worse in many indicators, including homelessness, unemployment, and criminal justice involvement. And COVID-19 has just exacerbated already negative circumstances for older youth, especially those aging out of care. So during COVID-19, we've seen executive orders or agency directives to assist transitioning youth and to suspend youth aging out. And that has occurred in Alaska, California, Connecticut, Georgia, Illinois, Michigan, Ohio, Rhode Island, and South Carolina. The Children's Bureau has also issued a federal letter which has urged assistance for transitioning youth. And really the plea was for all child welfare agencies to immediately contact all youth and young adults in colleges or other settings who may need assistance finding and securing housing while their college or university is closed. So before we hear from our panelists, we want to hear from you, and I'm going to turn things over to my colleague, Nina William-Bang, to conduct a short poll. Nina, it's all yours.
Great, thank you so much, Donna. The poll is before us. The question is, what kinds of supports did your state provide older youth transitioning from care during and after the pandemic? And your choices are allowing older youth to not age out of foster care, offering additional financial and other assistance, including housing, allowing extended foster care beyond age 21, waiving conditions such as employment and educational requirements, conducting a telephone wellness check on youth. Another answer is, I don't know. And our responses are coming in. I'll give a few more minutes to get as many responses as possible. Folks are still voting. It looks like, give another few seconds. It looks like 58% of respondents do not know what kinds of support have been provided. The next category, there's a tie between allowing older youth to not age out of foster care, 26% of you. Another 26% said your state allowed extended foster care beyond age 21. And also at about 26% your states offered additional financial and other assistance. 5% each waiving conditions such as employment and educational requirements and conducting a telephone wellness check on youth. Thank you very much for doing the poll.
Thank you, Nina. I think I saw a glimpse of Sitsto. So if that is the case, I'm going to turn it over to you. I'm so delighted to have you with us today. So the floor is all yours.
Thank you. It's such an honor to be here. Forgive my internet difficulties. We have Optimum here, so I think we should be good.
Okay.
So first, let me say that I'm just so grateful for the work that I've just been seeing across the country. Over the last 6 months, we've been, in the presence of young people, staff, legislators, folks who've been just working around the country. And I don't think we say thank you enough sometimes. So I just wanted to pause and just say, thank you to everyone who's done so much great work, because we really could not have seen what's going on in terms of meeting young people's needs with that. So I just wanted to share a little bit about myself and about Think of Us, and talk a little bit with the other panelists about what is going on now. So my name is Sixto Canso. I'm the founder and CEO of Think of Us. And we are a systems change nonprofit that looks at how do we incubate new bold ideas and then put them into practice. And so during the during the pandemic, we've had quite a bit of work to do. And so whether it's redesigning a quarantine program to supporting the federal commissioner thinking through by building bridges to young people so that he is informed and has that proximity with youth, to fully going in and looking at what is a new system might look like. And so one of our newest projects is looking at how do we add a new division to a child welfare agency in one state that would think differently from the ground up. One that's equitable, one that looks at the human being that's at the table with their race, with their orientation, with every aspect of their identity that's there. So I thought I'd kick off by always showing, just because sometimes when we talk about technology, when we talk about tech what you call it, interventions, it could be a little difficult to kind of describe these things. So is there any way I can get access to sharing my screen?
Yeah, absolutely.
Awesome. So I'll start off by saying, we went into a national emergency on the 13th, March 13th of 2020. And by the 19th, we were able to host a town hall with the Associate Commissioner, Jerry Milner. And what was unique about this town hall was the fact that it was not only just one of the first town halls that happened, it was the first town hall that happened across the federal agencies. But what really makes this unique was the fact that it was it was this agency that decided that they wanted to hear directly from young people what was going on and having that proximity in order to make decisions. As you know, in very challenging moments, it's those decisions that we make that set the trajectory of how, people's life will actually be affected. And so it wasn't just about creating a space where people could ask questions, but it was about collecting the data. So when people registered, they were able to answer two questions. One of them were, what's the immediate need that you're having now? What's the need that you see coming up? And what we were able to do with that data was to gather those 1,600 responses and put them through software and let the software rank it. And one of the things that came up as the number one issue was food. And in the first week of when we had declared a national emergency, we still hadn't seen a lot of shutdowns. At that point, in the second week of March, we were only seeing Santa Clara County, the Bay Area shut down. And so when folks started to see like the number one issue was food, we kind of got a little questioned on it. And we were able to say, well, actually, that's what young people are bringing to us. And that's what young people are saying. 2 weeks later, we didn't see the country in a position where it all was in a shutdown mode, right? And as a result, we saw this real big movement around food for not just foster youth, but for everyone. So the importance of having that proximity is so key. One of the things that we also realized here was that there were so many people that were going to have to make decisions so quickly about what are the things that they have to make choices on to operate in this new world. And we immediately kind of thought to ourselves, well, the best folks to learn some great policy ideas from, great short-term interventions from, are your peers. And so we launched a command center. And the idea here was for us not to kind of figure out all of the problems ourselves, but how is it that we would be able to go ahead and highlight some of the questions or some of the things that folks were going through and then lift them up. So folks agencies trying to figure out how is it that I get technology devices to my foster families, right? It's one thing for the commissioner to be able to go ahead and release some flexibilities, but how does that look in practice? So being able to document an easy way for folks to understand that, but more importantly, being able just to have access to how others were doing it. So the ban on young people aging out of foster care was some of the most monumental and moving stuff that I saw. And being able to see how, being able to collect those resources from other areas so that folks can come here and see the stuff. So we did a good job in terms of like, when I say we as an ecosystem, to start thinking about the needs. But I want to just get a little bit real with folks and really start to say that although we did a lot, what I find still disturbing and what's really on my heart, and just, it is, like I said, this is the pandemic talking is my new slogan, which is we just haven't met the need yet. Like we've done so much for our young people, but yet what we're seeing in the data that we're getting is that over 56% of our young people are saying that they are struggling with their mental health, right? We're looking at data where young people are still aging out while the country is expected to be sheltered in place in many places, while the country is expected to social distance. we are putting our young people in positions where they have to couch surf, where they have to move. And I come to the question of, if we are in a situation where government is our number one response, right, to solve such a big issue, but yet the young people who are in the care of the government have not been able to have an adequate response, in my opinion, that actually meets the need. Not that we're not trying, but in this case, trying is the first step, but it's still not meeting the safety, nonetheless the well-being of our young people. And so those are very clear in the data, and I can start, like, I love data, so feel free to follow up with me so I can show you some of Dr. Greason's work and things of that nature. The other thing that dawns on me is that when I look at the disparities among race, when I look at the disparity among young people who are quote, not compliant, it really bothers me, and I have to say we have to question our policies. There was a young man in Connecticut. He was supposed to be doing his, he was quote, part of his engagement of staying in the system and staying in an apartment was that he was supposed to stay involved in his education journey. Being involved in a digital online format does not work for everyone. And so one of the challenges that he had was that he ended up in a situation where he decided to enroll in another education program, but he didn't communicate that to anyone. And so he ended up being forced out of his home, his apartment. He ended up having to couch surf, figure life out, and kicked out of the system because of what? Because one, a communication that right now our time is just not allowing to have with our young people and to investigate. But two, it was the policy that was used there. And although there have been some states who have like moved that policy forward, the reality is that there are a lot more places where we're approaching the situation, which is if you're not helping yourself enough, in my opinion, then I'm not gonna go ahead and do the extra mile because I'm also trying to support 20 other young people whose life, you know, are on the different domains of life are on fire. So I just kind of wanted to bring into the room the importance right now of really pushing forward on this issue of child welfare in a way that we probably should look at it differently than others. The unique relationship between a young person in foster care and the government is that at one point we were removed because we were told we would have a better future, we would have a better life. And unfortunately, what I'm seeing is that engagement right now is just not being, that promise right now is not being lived up to. But I'll stop there for
Thank you.
I don't want to take all the time.
Thank you, Sisto, for a lot of salient points that you bring up, and we'll have more time to talk when Nina begins to, you know, interview you and the rest of your peers. So I'm going to turn it over right now to Amanda. Amanda, if you could just tell us a little bit about who you are, how you're connected to the work, that would be great.
Hi, I'm really excited to be on. I think I'm in like probably the earliest time zone right now, unless there's Hawaii on. But my name's Amanda Mativier. I'm from Anchorage, Alaska. I am the director and co-founder of a nonprofit organization called Facing Foster Care in Alaska, which I helped to co-found when I was still a teen in foster care myself. And I've been with the organization now, it'll be 17 years in October. I'm, like I said, a former foster youth myself. I aged out of foster care in Anchorage. And my husband and I have also been foster parents to teens for almost 13 years now. So I actually got emergency licensed as a foster parent not long after I left foster care myself for a friend of mine, and just have continued on that journey. To tell you a little bit about what we do, I can say absolutely all the things that Sixto said has resonated here in Alaska with a lot of the challenges that young people have been facing throughout the pandemic. And I think it's shed light on a lot of gaps in our system. But I also think that some good things have come out of it too, in terms of like at least our state government's response to young people. So through Facing Foster Care in Alaska, we're a statewide nonprofit. So we have young people in and from foster care all over Alaska that we help to build up and engage them in advocacy. So every year we bring a group of young people to our state capitol during the legislative session. It's something that started out as a very grassroots effort for us to even just try to get like airline credits to get young people on an airplane and into our state capitol. Our capital, to give you a little bit of perspective, is only accessible by plane or boat. So it's in Juneau, Alaska. And so traveling from a very rural community can be like going basically from like Europe to, across the country to try to get somewhere. So it can take multiple days. It's very expensive. It could involve bush planes and snow machines and four-wheelers and things like that. And so we make a big effort to get young people into our capital and engaging with lawmakers every year. And so we host an event every year during session. So we do a lot of youth-led advocacy, meeting with our state government leadership as well. And then training, we do training all year round where young people come in and actually talk to all incoming child protection staff. We have an entire day that's dedicated, it's Older Youth Day, where young people come in and engage with new child protection staff. And then sort of by default, we've become this network of peer support where young people just find this connection. And I found this really strong connection to just engaging with other people who have been in the system and who have experienced a lot of the same challenges. And so in a lot of ways, we just lean on each other and build each other up. And we've created sort of this network and this community where as young adults are transitioning, a lot of times they just lean on other young adults and not so much service delivery systems because it's just a more natural kind of experience to ask your friend for help than it is to ask a caseworker for help. And then in addition to all those things, I also manage the college fund for foster youth statewide. So our education and training voucher program, we have 3 different types of tuition waivers at this point for our public university, our private university, and then we have some state funded tuition assistance that our young people help to lobby our legislature for. So that's kind of it about me. I'll wait till there's more questions coming from Nina and pass it on to the next introduction.
All right. Thank you so much, Amanda, for sharing your story. Galilea, I'm going to turn it over to you if you want to just introduce yourself and tell us a little bit about your work and what you're doing.
Yes, before I start, I do want to apologize. There is construction going on outside. So I'm going to try my best to be as loud as I can so everybody can hear me. My name is Galilea Carrasco, and I'm a part of Think of Us as well. And, really here, I want to share my personal experiences. I'm currently 19 years old, so I am a non-minor dependent still in foster care. And the way that I view, transforming the foster care system, it's a collective, it's collective work, right? It's about our foster youth, our young adults in the system, our legislators, our everybody, right? We're all doing this work together. So I'm going to be sharing my experiences and also connecting it to some, I guess, some ways that I could see things changing just so we can make life a bit easier. So I am now a sophomore attending San Francisco State University, but I did have to leave in the spring around March because of the pandemic. And the day that my college had issued the return back to your home order, I was actually in a hospital getting some exams done for seizures. And I had been told that when I was going to go back to where I was living, I needed to be monitored. But the day that I got released from the hospital, I was actually on a plane to Mexico to be monitored because I wasn't going to be able to get the right type of, help back at the dorms because no one was going to be there, right? Everything closed. The Guardian Scholars Program that's there to help foster youth closed. And I was left to wonder what was I going to do. I stopped receiving treatment with my primary provider, my neurologist, my medical team. The hospital was no longer able to follow up with me because things were changing very quickly. That happened in March. From the second week of March all the way up until, I believe, maybe mid-May, I had been in about more than 5 different placements, moving between different counties. So what does that happen, right? I stopped being able to get I stopped being able to use insurance from San Francisco. Therefore, my access to treatment became very unstable. There was a very huge increase in my episodes with my seizures, with my mental health, my PTSD symptoms, because I was constantly moving between placements. And on top of that, I wasn't able to get the adequate resources because by the time I had moved to a different county, the previous county's insurance had just kicked in. So I was constantly stepping on eggshells. I felt like I was, running against time and trying to find my footing. And the way that I look at this is, well, okay, there is an instability in where I'm living. Okay, there is instability in my treatment, but why? Well, when we look at Medicaid, Medi-Cal is under Medicaid, and that's the primary provider for foster youth. So my thinking was, you know, what could change or what could be added that can make this easier? The way that I was thinking about it was like, maybe like sticking with your insurance of origin. So my life was in San Francisco. I had created a medical team up there, great people, but because of the pandemic, I had to leave. So maybe they could be a change in policy where we're able to stay with our providers that we were currently at before the pandemic hit. Because if that was the case, it would have been so much easier. I was finally able to get access to a neurologist in June when I had been needing to see one since March. And it did put a stump on my treatment and, you know, even getting on medication. So these are things that are very sensitive, and it's very difficult, especially navigating through the different like hoops that you have to jump through being in foster care. And the transition from being, you know, a minor to now non-minor dependent, a lot of that falls on me to do. Yes, we have, you know, social workers, but at the same time, a lot of it's up to us to figure it out most of the time. And I just want to really emphasize, like, being in foster care, having a medical diagnosis, and also, you know, not being able to return back to a home. It was really difficult to do. Before I left to San Francisco, I was in a transitional housing program, so I didn't get to actually return back home. So another idea that I had was issuing maybe emergency housing. A lot of the transitional housing for young adults in foster care, there was lists and lists of waiting lists, so I wasn't able to get into anything in time. So maybe having some type of emergency housing would be really helpful in my perspective. But I just wanted to come on here, you know, and be a part of this conversation and really just share my experiences, because I think it brings so much more, I guess, perspective to the conversation. Thank you.
Yes, it does. Thank you so much, Galilea. You all, the three of you, have brought up lots of issues. I'm gonna, you know, just remind folks that the chat box is open for questions. I'm gonna not add my own commentary, but turn it over to Nina, so Nina can ask you a few questions that she's prepared for you all, and we'll just continue to sit back and learn. So Nina, I'm gonna turn it back over to you.
Great, thank you, thank you. That's fantastic. Both Sixto and Galilea led us off with a lot of great details about some of the ways that they've been impacted by COVID-19. And I wonder if we could talk a little bit more about that. You know, specifically, we heard about certainly young people that are in college. We've heard about the medical issues, some of the housing, certainly food insecurity. What are some of the other ways that COVID-19 has impacted and continues to impact either yourselves, some of the other young people that you work with, that you'd like the legislators and legislative staff in the audience to hear about, that maybe they haven't thought about when thinking about how COVID-19 is impacting everyone in their state? You're muted, Sixto.
Thank you. One of the things that comes top to mind for me is that there was a group of young people, there was a group of American citizens who we were on a healing journey and a journey to figure out how to become self-sufficient. And so there were programs in place, like the independent living program, right? There are programs in place that are here to help us on our journey of healing and developing so that we can be competitive members of society. And this pandemic has forced like the frontline social workers, frontline staff to start just working on emergent needs, which means that, you know, the core of healing through and dealing with your trauma, we're not really working on that anymore, because what we're working on is making sure you're eating, making sure your placement doesn't get disrupted, making sure you're still housed. And so I'm very, very concerned that because adolescents and young adults that are in the system of child welfare, it's the system's responsibility to teach them the way it's structured. It's the way the current system is structured is that the system takes on the responsibility to teach different life skills and provide that opportunity to like build the skills to be self-sufficient, that you're not getting that. And then the organizations that are usually doing that intervention, they have now been pushed in our field without having a history of doing a lot of digital engagement to be digital. And so one of the things that we found was that we have just a lot of transferring of like, let's just get on Zoom to do the work. It doesn't work that way. And so what we did was we looked at what are the actual tech-enabled interventions that work out there. And we were able to map out some of them. And so the first thing I want to point out is that we've only ever had mobile apps for 12 years. It might feel longer, but it's only been 12 years. That's one. Secondly, that means that if we've only ever had apps for 12 years, what are the actual tech-based interventions that that can actually work? We found a couple of them. One is called Beyond 12. They coach young people from the beginning of their inception, from senior year of high school, all the way through, college. Their results today, the 97,000 young people that they've coached with an algorithm plus a virtual coach that talks to you, calls you, checks up on you, is that 85% of the youth who've been coached for 4 years at the 6-year mark graduate or are still in school compared to the national average of 42%. They don't serve any foster youth, but that's amazing results. But they serve first generation students. So I called them and said, come serve our young people. Mental health, Beyond 12, Mind Right. It's a text-based intervention where it's about mental health coaches that are not full-fledged therapeutic interventions to be therapy, but it's the step right before there that you have your own mental health coach that's talking about wellness and what that means to you, just destigmatizing what it might mean to get to the next step. 73% response rate over a 10-week period. It's all text messages. That is absolutely like crazy in the world because 85% of self-help apps stop being used within a 5-day period, right? The M-Relief has provided 425,000 families with support to unlock food stamps through a 10-question text message application. And they're in 44 states. So there's these efficiencies and there are these tech interventions that provide access or full-on coaching that are not currently reimbursable, that are not currently part of these budgets that states have. And I wonder if there's a way that we can actually start thinking through how do they become reimbursable, because that text message intervention, now the private sector is starting to go ahead and reimburse for them because they saw that it was actually reducing the number of hospitalizations during this time. So there's some real cost savings that are coming out of some people who are doing digital interventions before COVID that right now we can double down on and say, actually, can you serve our most vulnerable populations also? We'll help you get adopted to foster youth. We'll help you get adopted to juvenile justice youth. Let's really work to figure out how we can make sure that those programs can scale, because by the time our sector gets caught up, it's gonna be another couple of years before we figure out efficiently how to do what we've been doing in this hybrid mode of in-person, not in person. And I'll go ahead and start putting some of these right into the chat because I see that folks are asking about those.
Thank you, Sixto. That would be fantastic if you would do that. That would be great. Amanda, did you want to comment on specifically ways that COVID-19 has impacted the young people that you work with there in Alaska?
Yeah, we've obviously seen a lot of the same things that happened across the country. College dorms closing, and like Galilea said, like you lose your home. We had majority of our teens, about 25% of the youth in foster care in Alaska are teenagers, and we already had a lack of foster homes, and so a lot of older youth were in places like dorms while still in foster care or Job Corps or vocational technical type programs. We have a lot of boarding schools here. And so we saw this first wave where dorm housing started to shut down. First, we saw it across the country. I just saw on social media, like all these young people are having to leave their college campuses. And so we sort of jumped on it. And I think we're fortunate in being sort of like a big, small state and that our population is smaller and there's a lot of personal relationships. So I just called the director of dorm housing at our public university and said, like, hey, like, what's up? And he said, yeah, we're gonna close, but we're making very specific exceptions. And they were able to actually, our public university made an exception for all foster youth to remain on campus, which I'm really grateful for. But then the issue was there was no meal plan. all classes went out online. And so the isolation around just being alone. And so we're hearing from all these young people who just felt so lonely, and then it exacerbated those symptoms of post-traumatic stress disorder and anxiety. And they had challenges just with logging on for their class because they couldn't get out of bed because they were just so overwhelmed by the experience. And so trying to figure out ways to respond to that, just not just through Zoom, but for us, we use a lot of social media or offer opportunities for young people to connect with other young people through texting, through Snapchat, through other online type groups. And so that was one sort of big thing. Another one, just around the foster home issue also. So to give you a little context, our numbers are lower because our population is smaller, but we have about 3,000 children and youth in foster care statewide. We have 1,400 foster homes. But a number of foster homes, if you have foster parents or children who already had their own medical issues, maybe they were older or they had respiratory issues, things like that, they were not going to allow children to be placed in their home because they were worried about children coming in who maybe had been exposed to COVID. But also, we had a lot of teenagers, I guess you could say, blowing out, right? Because they just couldn't stand to just be sitting in this home, or maybe it was a new placement, or maybe they had to leave Job Corps and now they're with strangers and they're struggling to adapt to this new environment, and the foster parents wanted them to quarantine. So we've seen a lot of that, and now young people who are being placed in, Anchorage is our largest community, half our foster care population and our just general population is here. So Covenant House is our main youth shelter. So we saw a lot of teens starting to go to Covenant House, but now they have positive COVID cases. And so we've started to have conversations with our young people about placement at the shelter, if that's not somewhere they want to go, and the state putting them in harm's way, and maybe them talking to an attorney about their own safety around, being placed in an environment that could actually make them sick. So those have been just incredible challenges. We were able to respond fairly quickly in terms of transportation type related issues, like our public bus system shut down. The FYI vouchers are pretty popular across the country right now. So there's a voucher program for young people to get into their own apartments. So we had a number of young people shopping for apartments or waiting to get into places, but now that's already hard enough to try to figure out the process of finding an apartment, signing a lease, all that goes along with that. Maybe you're riding the bus to get places. The bus has shut down. Maybe a young person had a job at a fast food place or the grocery store. Now they can't get to work. They're an essential worker. And so the housing authority here has granted additional exceptions for those FYI vouchers, which has been really great. We have been shelling out, we started a COVID emergency fund for the community to just donate. We've been shelling out Lyft credits, and we just do it right through the app, and we just transfer Lyft credits through text, and we're paying for youth to go work at the grocery store so they can get back and forth to work, or McDonald's or wherever. And so we've spent thousands of dollars on Lyft tickets or credits so that youth could still work. And it's something our independent living program, state agency, there's red tape to be able to do that. And we also did a bunch of, and we're still doing e-gift cards for things like food. So we're able to transfer, through email or through text. They can get to the grocery store, we can send them Lyft credits so they can go purchase food if they absolutely need it. Or we're doing a lot of DoorDash. So you can have food delivered if they can't get out, and if maybe they still are in the dorms. And also, additional challenges, we have school starting here August 24th for college again. So again, our university has made exceptions. We've had youth that have remained on campus all summer, and I think we've been really fortunate in that way. And they're allowing youth. We had one young person that our public university just let him move on campus. They have no paperwork ready. The dorms aren't really ready unless students have already been there. They just let him move on campus. And so we started a fundraiser through Facebook. We raised $8,000 so we could purchase things to get him set up and ready to be able to, again, it's that isolation. He's still alone in his dorm. Classes are online. Food is a challenge. We pushed, I know this is the next question, but we pushed pretty heavily on our governor. I first saw Illinois, I think it was, extended care beyond 21 and allowed youth to not age out. And so we pushed on our governor to extend foster care beyond 21. And he's been issuing emergency orders on a monthly basis, but it started in April. He extended it through May, through June, July. We just got the August, and we're hoping that the state will continue to do that. I think we were fortunate also in that the foundation was sort of already laid out for a lot of young people to have at least some safety net. Our youth, educated our legislators and really worked to beef up services and supports for the independent living program long before any of this happened. And then also moved toward, we actually got our state agency to take it a step further than we had a law passed. But for any young person that's going to get the goal of APLA, OPLA and some other states, another planned permanent living arrangement, so it's long-term foster care, they're going to age out. It has to go through really extensive efforts here to give a young person the goal of APLA. So the state has to make a lot of effort to try to find a permanent family or permanent option. And then it has to go to the director of our state agency to sign off. So a few years ago, we went from hundreds of youth aging out to there were only 12 young people with an APLA goal. So there was all this, stuff that happened prior to try to get youth into permanent family type situations or with relatives or in a home setting. Because our young people kept saying the best independent living program you can give us is a family. So when it came time to ask for care beyond 21, we only had 14 youth that were set to age out during that time frame. And initially the response was, well, it's only 14. Even if it were one, we should still allow them to remain in. But I think because of our state's response prior and also for extended foster care, our state didn't take the option, the federal option. And so we didn't have all these requirements of young people being in higher education or in jobs to remain in extended foster care already. It was a lot looser. And so I think we're also fortunate in that way, and that Alaska tries to sometimes, I think, reject federal policy and sort of we do our own thing, but it's worked well for youth.
Great, Amanda. Thank you. Thank you. Galilea, did you have more comments? Did you want to talk about a few more impacts that you've seen with the young people that you've been involved with or yourself? You talked to us about the medical and the college issues.
Yeah, and I'm just adding a bit more context to when it comes to being like a foster youth in college. We do have, access to the Garden Scholars programs, the Renaissance programs, but it's way beyond just having, like our case manager. You get a safe space being at college. So already, like, statistically, you've seen that it's the numbers are fairly low for foster youth going into higher education and even receiving a degree. So when I was there, it was really nice. And my school has almost about, I want to say 27 to 29,000 students. And out of that number, about only 92 are foster youth. So it was a beautiful thing to be able to connect with other, fellow foster youth in my school, seeing them in the lounge, just going to take a nap after a really hard day at school. And then when the pandemic hit, it was just so abrupt how the community just ended. You can try and move it into a digital space, but you no longer have the option to go into the lounge or go into your case manager's office and just pretty much let everything out, because it was very overwhelming. And going back to I guess just emphasizing what Sixto was saying about the mental health portion, I can say for me and as well for fellow friends of mine who are in care as well, it definitely took a toll on our mental health because we no longer had access to those safe spaces. So what exactly is your safe space? How are you able to recreate that? And that's just something that I see happening right now. That's a bit tricky, and it happened when COVID hit. But that was another point that I just wanted to emphasize, and it's happening. Even now, I cannot speak anymore. Like, I have so many thoughts going through my head. But for this semester, our school will once again be closed. So therefore, the office, the program space is also going to be closed as well. And we no longer still have access to that community. So I guess the question is, how do you still reinvent that safe space? What needs to change, and how do we still keep our foster youth in college connected? Because during these times, I feel like we've all kind of felt disconnected in some sense.
Wow, that's fantastic. Now I'd just like to ask you all to share with us, and you've already started doing this, a couple of strategies that you've seen that have worked successfully. Sixto's talked about the tech, and I think that's just mind-boggling. That's just incredible. And some of the things that have been done in Alaska, if you all could respond a bit more, some strategies that you've seen that other states might think about. Certainly, it sounds like extending care beyond 21, would be really helpful for students thinking about their tech needs. And yeah, schools opening again, and what kind of strategies? Have any states come up with strategies to prepare for that, to continue to help the young people? And whoever wants to start first. Do you have more to add, Sixto? Unmute yourself. So you've got your
Sure. I
mask
was
on.
going to say, Amanda, if you want to go first. I have the cable people drilling here.
Yeah, that's fine. So I think in terms of like strategies to respond to youth, I had mentioned the Care Beyond 21, and then just resources without red tape. And so that was like our response, and being able to just send things to young people. Gift cards. We have a laptop program, so we match young people with laptops all across the state. They just basically fill out an online form with their name and address, and we send it to them, like no questions, we just do it. And then we've also beefed up our effort to get equipment out, but I think there's always going to still be challenges. Like we have communities that are so rural that they don't have internet access, and so online schooling is not an option. And we even tried to buy like Wi-Fi hotspots and things like that, but it just won't work in those areas. And so I think states coming up with a plan ahead of time so that we're not getting into this like crisis response, people calling the governor's office to try to come up with a solution at the 11th hour, where young people have already suffered. Like we need to get out in front of it. And I think young people in and from care have been saying this for a long time and have been offering up solutions for a long time. And I think the pandemic has shed light on some of the things that we've been talking about for years and years and years as an issue. And you end up with all these people in crisis, but finding out also strategies or ways to support youth that are making that leap or are making that transition. I can say, like, for myself personally, higher education was my way out. That was it. That was the next phase. I spent years, on the run. I dropped out of high school. And when my caseworker showed up and said, you could go to college, I mean, that changed the entire course of my life. And so that's why I've dedicated so much to other young people going to college that are coming out of care, because I know that it can just, shape who you become as a person and what you're exposed to and where you go next. And it really does, determine like the next phase of your life. And so figuring out ways to support youth in college through exceptions to allow young people to stay on campus at both public and private universities. Finding ways, I know that there's been loosening of some of the rules around financial aid. One of the things that we're trying to work toward here is our education and training voucher. The policy is that youth have to be continuously enrolled on their 21st birthday to continue funds until they're 23. We have a ton of youth that are turning 21 this fall that don't want to take courses because they're worried about being successful online. But if they were to continue, beyond their break or beyond fall, they would graduate. And so we're trying to allow them that exception or that opportunity. And so we're just waiting on an answer back. But really just like, getting rid of all these weird eligibility rules we have for everything, whether it's financial aid, access to technology, access to different housing options for group homes, vocational technical programs, placements. There's all these expiration dates with regard to age, I feel like, all the time. And it's hard for young people to keep up with those anyways, but like just, like loosening up the rules in general and allowing youth the opportunity to be successful without all these sort of mandates in place.
One of the things that come to mind for me when I think about the next policy, where we're at as a country, is that I had to take a moment and say, okay, beyond foster care, what we are in is a situation where states and the federal government, we have budgets that are unbalanced, really big disparities, and what's going to happen to communities, right? And so I was thinking hard about how do we make sure that we learn from what we've have gotten in the past, which is, and I put this in the link here, which is we know that the negative outcomes for our young people who age out, that there is a severe cost that comes with it. $2,000 worth, almost a week for homelessness services, about $300,000 a year when we're engaging with the justice system. Our pregnancies end up costing us about $250,000, and I can go on and on and on. And so what that brought to me was the idea that how might we figure out how is it that we could go ahead and not experience some of those some of those, like incur those costs because literally the state can't afford it. And so I talked to you about part one, which was this idea of there are digital interventions out there that work, that have some promising data behind them. I think the second piece here is that in order to have meaningful interventions that avoid a young person going from, aging out to pipelining straight into prison, pipelining to another governmental services or a governmental emergency service, right? Spending that one night at the emergency room because I don't have a place to sleep, right? Which we hear from our young people. It's having this idea of a peer navigator, someone who has gone through the system, knows very well, not all the resources in a system, but they know one thing very well, which is how to do the application, say the things that they need to navigate it. Because to streamline all of our benefits might be very difficult at this moment. And so we thought we're testing this idea out of peer navigators show up, and they are the ones who help the frontline staff, relieve them from spending their time on all the emerging things that are coming up, these emerging needs of like, oh, you need food today. Oh, you need to find the right apartment for you so you can take advantage of the FYI voucher there. So by making things more efficient, by bringing on this group of people who have learned how to bureaucracy hack, as I like to say it, and then allowing them to reduce the number of hours that these paid staff, whether that be at government or nonprofits, are spending on some of the things that I believe that other young people are best positioned to. That 27-year-old, that 29-year-old, hire them to support that 18, that 22-year-old in accomplishing that application for their, HUD voucher, accomplishing that food stamp application, so that now we're putting money into the economy by hiring more people. Let's keep that going. Secondly, we're making sure that that pipeline doesn't drop just because the services have been offered, and thank God there are some resources out there. It doesn't mean it's accessing them is the easiest pathway. And when we're navigating all of these other issues and all of these other populations that need support, I can't imagine that like redesigning some of the things that we need is the first thing on people's list right now. So how might we be able to engage so that then we are looking at a situation where a peer navigator is helping you get that rental assistant, is helping you know that there's this internet deal that you can get if you file showing that you have low income, right? Things of that nature. So then that way the people who are working on the long-term intervention to making you self-sufficient and heal, that they're able to focus on that piece.
Great, that's fantastic. You've all given us just extremely great examples and rich insight that I think will be helpful for lawmakers. We do have some questions from the audience, and I'm going to turn this back over to Donna, and it could probably get at some more things that you wanted to bring out as well.
Having trouble unmuting myself. We actually don't have any questions from the audience, but I do have a final question that I'll ask our panelists, Nina, before I turn to you just to wrap us up. And that question simply is, what role can state lawmakers play in supporting older youth in foster care in response to COVID-19? And I know you all have given us, lots of stuff, and it may be the same. And so if you don't have anything additional, don't feel free, don't feel compelled to, make anything up in addition. But if you had just, maybe one little nugget you want to leave on the minds of lawmakers as we start to wrap up, what would that be? And Amanda, I'll start with you, then I'll let you ping it over to Sitsto, and Galilea, I'll let you wrap us up. How's about that?
Sounds great. In terms of what lawmakers can do, I think bringing young people to the table. I think that you can listen to administrators, you can listen to agency heads. We've been, again, really fortunate in Alaska that on both sides of major parties in our state government, and for years and years, they've listened to young people. We also live in a state where it's small enough you might see your representative or your senator in the grocery store. But they've created safe spaces for young people and have really genuinely engaged. We've had state lawmakers that have individually mentored young people, have offered up internships, but it's become this really solution-focused opportunity, but it's also given youth the opportunity to grow and to develop. I was mentored heavily by a state lawmaker who was also a former foster youth, and I learned some pretty basic life skills about things, even just like showing up on time and how to, you know, like be a professional and sit in a professional setting in a meeting. But at the same time, like I didn't realize I was getting all these things out of it, all while like transforming the system as well. And so giving young people those opportunities to come to the table in person, virtually during session, but to offer up solutions. Cause I think young people know best. We're, you know, foster youth, the ones that are living and breathing it every day.
Yeah.
And so should be asked for the solution.
Yeah, thank you. I appreciate that. Sitso, what's your final thing?
Final thing here is that currently there is a bill on the Hill. I was trying to go through my email as quick as I can. I'll follow up. But there is a bill that just dropped last week. And it's about providing some of this emergency relief, and it's about making sure that some of these issues are addressed. And so to the extent that you can support it and like work with your constituents and work with your representatives to help push that through, that is the only thing right now that is on the Hill for us. That's exclusively tailored. So that would be helpful. And then as you think about solutions that go further, I think about solutions that put our young people to work, put our young people in school. There is nothing much more important right now than work, school, and mental health. So to the extent that we can make those three prongs easier, we can do a lot of good, not just for our population, but for the country.
Thank you. Hallelujah.
Okay.
Take us on home. Yeah.
We've been doing so great without the construction, and now here we are. But I just really want to emphasize what Amanda was saying about, you know, our youth, our young adults in the system having a seat at that table. And what I've said before, it's kind of a phrase I say is, you never really know what's going on until you bring someone who's really been in the trenches, you know, and really going through every obstacle and those barriers. Because as you've heard, although we are all although we are all in the same system, we all face different barriers. You know, not everybody has a medical condition. Not everybody is dual status in juvenile justice and foster care. So it's really important to bring in these young adults, to bring in these youth, you know, to your meetings, to the conferences, to these conversations. So, you know, like I said before, it's a collective work together. We are all collectively doing this together, and it can't be one above the other. We have to work together to do this. And another thing as well would be to support policies and legislation that can help our youth. So for example, like in California, right now we have Senate Bill 912 that's currently awaiting Governor Newsom's signature. And with this, with the Senate bill, it's extending foster care past July 1st, 2021. And, you know, as Sixto mentioned before, like you could only imagine transitioning out of the system in the midst of a pandemic, because we don't really know what the future holds. So those are just some of my final thoughts is, you know, allowing those youth and young adults to be a part of these conversations, and also, you know, supporting policies and legislations that are going to help add stability to our lives.
Yeah. Thank you to the three of you. We are very grateful for your personal stories, your testimonies, your accounts. I got to turn it over to Nina so Nina can do our final sort of wrap up. But if you want to drop anything additional in the chat while Nina is just sort of wrapping us up, I thank you all so much. You have put the end of our series in a very helpful place. So thank you so much. So Nina, it is all yours. Final minute.
Okay, fantastic. You all have been just phenomenal. I just want to point to NCSL resources on human services and COVID-19. Child welfare, we're also tracking any legislation introduced or passed related to COVID-19 and other resources. And we have a great couple of websites on older youth in care, 50 state charts, maps, easy to access, a 50-state data map. We've got 8 state profiles, and we look at everything like housing, financial literacy, extending foster care, driver's licensing, and several other issues. So please feel free to access our website, and this information will be recorded that we've heard today. So that you can, you know, get further information and hear the recording again. And we also ask that you do Think of Us resources are available here as well. And we do ask that you fill out our online evaluation so that we may bring better programming to you in the future. If you'll take a few moments to do that, we'd very much appreciate your help.
Thank you, Nina. Thank you, everyone. Have a very wonderful rest of your afternoon. Take good care.
Yes, stay safe.
Survey before you leave if you have a few moments.
And thank you for those who are filling out the survey. We encourage everyone, if you can, to go ahead and do so. It's still up. It will really help us. Keep accessing our website. We update the COVID-19 and child welfare resources regularly. We will continue to do that. Again, all of the information, the contact information, the resources from Think of Us will be on this recording and on our website.
I see there's a few people left, but I was just gonna ask, I just sent the document with the talking points and the link to the actual the bill for the means and ways kind of summary of it. I don't know if that was possible to send to people, but I know they're trying to drum up support, seeing that that is something that might be voted on quite soon.
You're muted, Donna. Also,
Yeah,
everyone
I was. I was just saying, yeah, thanks for sending that. Shannon, maybe we can grab it out the chat